Good morning, everyone. Thank you all for joining this event online. I, I really appreciate you all spending time, and my hope is that at the end of this hour, you will have an interest in partnering with us to further the work in advancing radon in your community health assessments. I do want to say hello also to Kathy Dale. I see her also online. So I appreciate you being here, Kathy. Thank you. We are recording this event. I will be distributing the recording out to those who request it, but we'll also post it on our website for those who may be interested in this information at a later date. Again, we'll begin now. My name is Philip Gibson. I serve as the North Carolina Radon Program Coordinator, and that's with the Department of Health and Human Services, specifically within Radiation Protection Section. I appreciate you being here again and the opportunity to speak about the information that we have to share, as well as technical support that the Occupational Environmental Epidemiology branch can provide. And I believe that this will be helpful for many of you all in your work at the local level. The agenda for today is really, I'm going to present you with an overview of radon issues, the health risks associated to radon, followed by Dr. Faye Cohen-Mark, who will be presenting information from and technical expertise assistance available through the Environmental Public Health Tracking Program. And then Angela Johnson, who is the Assistant Director at the University of Missouri Center for Applied Research and Engagement, will be presenting the North Carolina Data Portal. This is brand new, as well as the dashboard that Faye will speak about. So these are new developments, and hopefully this will be of help to you. So as a background, radon is a radioactive particle. It's found naturally throughout the world. And uranium, which is present in all rock and soil, breaks down over time and releases radioactive particles. When these particles rise to the surface and enter the air, we can breathe them in. Because buildings often create a negative pressure or a vacuum effect, radon can accumulate and concentrate indoors. And research shows, national research shows, that about 1 out of every 15 homes in the United States has a high radon level. High is defined as 4 picocuries per liter of air or higher. While radon originates naturally in rock and soil, those same materials, the rock and soil, are often transported and transformed into building products such as concrete, gypsum board, and sandstone. In some high-rise or large buildings, elevated radon levels can be linked to radon released from these building materials. Additionally, in North Carolina, 61 counties have geological formations that can affect private well water. And when this occurs, radon can travel through private well plumbing and be released indoors, increasing exposure levels. The United States Environmental Protection Agency and the Centers for Disease Control and Prevention identify radon as the leading cause of lung cancer among non-smokers. This makes radon a significant public health concern, even for individuals who have never used tobacco. For individuals who have smoked 100 cigarettes or more in their lifetime, what we refer to as ever smokers, the risk is even greater. Smoking increases a person's risk of lung cancer by 10 times, and when combined with radon exposure, the risk increases substantially. As you look at this table from the Center for Disease Control and Prevention and used by the Environmental Protection Agency, I want to draw your attention to the row for 4 picocuries per liter. This table reflects lifetime exposure and an annual average level. So 4 picocuries per liter average exposure over a lifetime. At 4 picocuries per liter, the risk of radon-induced lung cancer is about 7 out of 1,000 for someone who has never smoked, or 730 out of 100,000. However, for an ever smoker exposed to 2 picocuries per liter, the risk is 32 out of 1,000, or 3,200 out of 100,000. This highlights how radon and smoking together significantly increase radon-induced lung cancer. The Environmental Protection Agency provides consistent recommendations to every state and tribal government. If your average level is below 2 picocuries per liter, continued testing every 2 years is recommended. If levels are between 2 and 3.9, mitigation should be considered. If levels are 4 or higher, mitigation is strongly advised to reduce health risks. Radon test data collected from 3 national testing companies between the years of 2010 and December 31st, 2024 are summarized here. The 15-year data set was cleaned and formatted by Andrew McRae of the UNC Gillings School of Global Health, as well as the team of the North Carolina Environmental Health Dashboard, Colleen Tennant and Faye, who will present later. This 15-year data shows that radon levels of 4 or higher have been identified in at least one home in 90 of the North Carolina counties. The remaining 10 counties reported maximum levels of 2 to 3.9. It's important to interpret this data carefully, though. Testing rates across North Carolina are relatively low, and they vary widely from county to county. So when we say a county reported high radon levels, we must also acknowledge that very few tests may have been conducted there. Limited testing can mean that radon risk is under-identified rather than absent. At this point, I want to shift from challenges and data to opportunities. Both the North Carolina Cancer Control Plan and the North Carolina State Health Improvement Plan identify radon-induced lung cancer as priority issue. Lung cancer continues to have the highest death rate among all cancers, and radon remains the leading cause of lung cancer among non-smokers. As we move forward as a state, we, the North Carolina Radon Program in particular, see community health assessments as a key opportunity to promote education and radon testing at the local level. Research conducted in the summer of 2025 by Courtney Baggins at the UNC Gillings School of Global Public Health found that from 2018 to 2024, very few community health assessments among North Carolina's 100 counties mentioned radon at all. Today, our partners with the North Carolina Data Portal will share credible and easily accessible radon testing data that can support the inclusion of radon testing rates in community health assessments. Presenting for the North Carolina Data Portal will be Angela Johnson of the Missouri Center for Applied Research and Engagement Systems. In addition, our partners with the Environmental Health Data Dashboard will explain how they can provide technical assistance to support your work. And with that, I'd like to introduce you to Dr. Faye Cohens-Mark, who is the GIS analyst with the North Carolina Environmental Public Health Tracking Program.
Thanks, Phil. Happy to be here. Let's see if I can steal the screen. Second. Present. That's not. Can you see that okay?
Yes.
Great. Okay, great. So yeah, as Phil mentioned, I am part of the North Carolina Environmental Public Health Tracking Program. And so we, excuse me, we sit in the Occupational and Environmental Epidemiology branch in the North Carolina Department of Health and Human Services Division of Public Health. So kind of nested within there. And just nationally, we are one of 33 state programs that are funded by the CDC. And this map here is just sort of quickly showing the other 33 funded recipients here. And so one of our roles as the tracking program is to really serve as a hub of environmental health and climate data specific to North Carolina. And so what this figure shows is that we collect various data on environmental exposures, such as air pollutants, and link it with information on things such as demographics and health outcomes, such as asthma or heat-related illness. And so we collect this from various partners across the state. We then standard and analyze this data to make it available through various public dashboards and web tools. And on the right here, we have listed some of our various tools that, you can, if you have any questions on, we're always welcome to chat more about these. But today we'll specifically be focusing on our environmental health data dashboard. And so the Environmental Health Data Dashboard, or EHDD for short, because it's a bit of a mouthful, basically brings together county level data to help understand key environmental health concerns across North Carolina. And so currently it has over 100 measures, things like air quality, birth defects, cancer, climate data, mortality, and as of now, radon. And so this dashboard can be used to explore potential environmental concerns that may contribute to health outcomes and health disparities. And we're constantly working to expand this dashboard. Right now, we're actually working with the State Climate Office to add about almost 30 new climate measures. And so today we're going to switch over to a little demo to sort of show you how this dashboard can be used in its various functions, and specifically the radon data that we currently have displayed. Let me switch to, well, I'm going to stop sharing here and okay. And again, the classic question, can y'all see my screen? Great. And my coworker is sitting across from me and I just get a big thumbs up over the monitor. So we're good to go. All right, so here is our web page for our tracking program. And if someone from our group will drop a link in the chat if you want to view along. So if you scroll down, you'll be able to view the NC Environmental Health Data Dashboard. To help, it's usually good to go down to the bar here and see this in full screen, and that will expand the dashboard for a bit easier access. Yeah, look at that. That's great. Okay, so here is our dashboard. As you can see on the top, we have these 5 tabs, each serve a different functionality on how you might want to view the data. And so for our first map, this is just a statewide map showing various measures by county for a select year. And so for all of these dashboards, fact sheets, et cetera, that we have in here, it's pretty much the same process for navigation, is a lot of drop downs to get to the indicators you want. So in this case, if we want to view some of the radon measures, we have our content area called air quality and pollution. And then we can see here, indoor air pollutants is what we select. And that will bring us to filters it to radon tests. And then we have our 4 measures here. And the font might be a little hard to see, but what I'll display each one throughout this presentation. But the measures include maximum radon test levels results for residential and commercial buildings tested, the median radon level test results, the minimum radon level test results, and then finally the number of residential and commercial buildings tested for radon. So we have 4 radon measures available on the dashboard. For this example, I'll go ahead and just choose maximum radon level test result for all residential and commercial buildings tested. And then for the last drop down, you can select your year. And as you can see here, we have the data available from 2010 to 2024, which is a great variety of data. Select it and we hit the magic green button and we get our map. And so this map is showing the maximum radon level test result by county. And so you can see that the map is shaded according to the maximum level test result. In here, we have it broken up into quintiles, so 5 categories, where the lightest of blue represents lower values, and then the darker blue represents higher values. And then in gray is just if a county didn't have data available. And so if you're interested in a specific county, it's easy enough to just hover over that county and you can see the results. So let's say I go to Wake County. And so for 2022, we see that the maximum radon level was 26.8 picocuries per liter in that year. And another great feature here, I'm actually going to minimize this again, is you have, for some reason, this is not able to be seen when you expand the screen, but there is an option to download data as well. And so here you can select if you want to download this image as a PowerPoint, a PDF, or just a regular image. And it makes it really easy to put into various reports to show whatever measure you've selected. So yeah, just a nice feature that just makes it a little easier to share the results. Okay, going back to full screen. And it's going to do this little dance. Okay. We'll go on to the next tabs. So previously we looked at statewide trends and we looked at 1 year. Here we're going to actually look at 1 county at a time, but look at a time series of data. And so it's going to be, again, focusing on radon. We're going to go through the similar drop downs: air quality and pollution, indoor air pollutants, radon test. Now we'll do median radon level. And then you can select your county of choice. I'm in Durham. I'll go ahead and choose Durham. Hit go. Great. And so what you'll see here is just earlier when I mentioned how we had, data available from 2010 to 2024, you can see that on the x-axis. And then you have on the y-axis just the median radon level for Durham over time. And again, similar to before, you can also download these images to use in various reports. So in the next tab, that's our comparisons tab. What's nice here is kind of how before mentioned, we have 4 radon measures and you can only look at trends over time for 1 measure at a time. So here you can actually select multiple measures and view them as a time series. And so that's going to come from this top, just 1 drop down this time, really minimized here. And you can select as many of these as you want. I once hit select all just because I chose chaos that day and it still made a map with 1 million lines. But in this case, we'll go to air quality pollution radon tests. If you wanted to look at other trends with this, you could always select For example, looking at things such as median household income data, or if there's other social factors, social determinants of health you want to compare. And so you can see as I select those, we start populating in the time series below. So I had selected median income household, and then we have our 4 radon measures here, where there's the maximum radon level, median, minimum, and then number of residential and commercial buildings tested. And then if you want to look at whatever counties, you just select them on the map. So we can choose Randolph County, that'll filter there. We can choose Gaston, you'll get that data as a time series. If you want to look at more than one county at a time, you just have to hold down the control button and select another county. And you can see that a second line is going to pop up, and that denotes the other county in its trend. And so you can look at right here, when you hover over the different points, for 2018, looking at Nash County, and then looking at Gaston County to compare the maximum radon level test result. Yeah, so that's one way that's nice to just sort of compare across counties across the state and over time as well. And so lastly is our fact sheets tab, which sort of takes everything we've looked at before and just combines it into one grand tool. What you'll see here then is basically the same thing as we have this statewide map that has a color gradient across counties by the magnitude of the measure, and then again, the time series at the bottom. So our favorite drop downs, I feel like by now we know exactly where radon is housed in this dashboard. So we select our radon tests, and here we can look at the number of residential and commercial buildings tested for radon. Again, we select our year, we can go with 2018, hit go, and the map's going to change. Great. And as you can see here, you just have to select your county. We can go with Mecklenburg. And so what's going to change is the text here, where it says, Mecklenburg was in the highest quintile for number of residential and commercial buildings tested for radon compared to other counties that year. And then we also have the time series on the bottom, similar to what we had seen on the other tabs. Yeah, so just an easy way to sort of get a lot of the information that we're looking at individually in the tabs all in one fact sheet that, again, you can download using the same function that I showed earlier. And then lastly, our About tab is really just sort of additional metadata about the indicators that you can view in this tool. So if we want to look specifically at some of the details about the radon data that we have here, where it comes from, et cetera, we can just go to the indicator group filter, which in this case is going to be air pollutants, indoor air pollutants, radon tests, and you have to squint, I think, probably a little bit to read this on the shared screen, but it'll be easier to read on your own screen. But you can see then we have some metadata displayed here for each of the 4 radon measurements that we have, and where that data is sourced from, and how you can learn more about that specific indicator linking to the North Carolina radon program. So yeah, I know that was kind of a whirlwind, especially since there's several tabs here. But that is more or less the functionality of our dashboard. Do I have a few minutes to switch back to my slides for a quick?
Yes.
Great. Okay. So stop sharing. This is my favorite game of sharing screens. I'm on this. Great. Awesome. Oh, well, that's not it. Okay. Right. Great. And then as we end, we just wanted to, sorry, then review just, some of the data limitations for the radon test results in our dashboard, just highlighting some of the things, Philip already mentioned about the test results that, they are provided voluntarily by companies. And so since it's voluntarily, it doesn't really represent all tests conducted. And so it's not totally generalizable. And then also in the tool that we just don't include state averages for these results, kind of going back because it may include some outliers. And so it kind of can skew state average results that might sort of detract from the data. And as Philip said, you just got to interpret the data with some caution. And yeah, thank you so much for listening. We also have the link here to our data dashboard and as well as our contact information. If you have any follow-up questions, our website also contains a link to our technical assistance form, which is available for local health departments and other organizations that might need assistance in creating various graphics. So definitely check out our website for that and other tools we are working on.
Thank you so much, Faye.
Yeah.
So next is Angela Johnson from Missouri University. Take it away, Angela.
Great. Well, thanks everyone for having me. My name's Angela Johnson, and as Phil said, I'm with CARES. Our center at the University of Missouri has been working with state and local agencies across the country for many years a lot of what we do is we collect data, we analyze it, and we display data, and then we create these data visualization platforms like the NC Data Portal, North Carolina Data Portal. If you're not familiar with the North Carolina Data Portal, it's home to a number of maps and tools that have been developed to help you really just find the data and information you need to do a community needs assessment or to fill out a grant application or to help you answer questions about your community using data. The NC Data Portal has two main tools. We have a health assessment and we have a map room. And both of these tools provide access to data across different topic areas. So we have, data on social factors, on health behaviors, on health outcomes, and of course the environment. Our center has a large collection of national data, so from national public surveys like the Census Bureau or from CDC, but in partnership with folks at North Carolina, we've been steadily growing the data in both the map room and the assessment tool to better align with what you all are collecting and measuring in North Carolina, to better align with your state assessment priorities. And to that end, we have, of course, incorporated new data on radon tests in North Carolina. A lot of the same data that Faye just shared in the portal. So today I'm going to show you how to access those data in the North Carolina data portal through both the assessment tool and the map room, and hopefully we'll have an opportunity for questions and feedback. So let's start with the data in the assessment tool. So there are, from the homepage, ncdataportal.org, which I'll paste in the chat right here, there are a few different ways to get to the assessment tool. So the first is, of course, right here, build an assessment. If you scroll down the page, there's another Get Started tab here, or up in the top navigation menu, if you ever were to navigate away from the homepage, through the Data tab, there's a Community Health Assessment button. So once you are there, to build a report, there's just 3 steps that you go through. You pick your location, you pick your indicators, and then step 3 is really just viewing your report. So our location tab is populated with different types of locations that you can choose for your report. So you can build a report from 1 or more counties. We also have a state option, or you could build a report for some predefined regions like the area health education centers. And these are clusters of counties or groupings of counties that are just pre-populated in the tool. For today's demo, I'm going to build a report for 2 counties. I'm going to go down to, let's pick, I think these guys are next to each other, Davidson and Davie. So we will go ahead and move on to our indicators tab next. So you can do that either in the top tab here, going to data indicators, or sort of hitting this next button to get you onto the next tab here. Now, as you can see, we have these indicators organized by category, things like demographics, which would come from our Census Bureau, from our education, from both North Carolina sources and national sources. And then if we scroll down here to physical environment, you can see our radon data, as well as some other indicators as well. Another way you could get to that data, let's say you weren't sure exactly what category you were in, we do have a filter option where you can type in a search term, and if that term matches one or more words in the indicators or keywords, it will filter to just what we're looking for there. So typing in radon, I can see I've got my indicator filtered out here. I can select that and move on. Let's say you wanted a little sneak preview of what you might be getting here. We have this little info pop-up button where you can see some of the data attributes that are in, that'll be loading in the report, as well as the data source and things like that. So I've picked my location, I've picked my indicators. Step 3 is, again, just to view our report. So as our report is loading here on the page, just to orient you into what this is going to look like, for each of the indicators that you would pick, the data loads with a short description of sort of what the concept is, what the data are reporting, a quick view data table with some data benchmarked for our report location to our, if our report location contains components like these multiple individual counties, those will load, and then our state average. Continuing to scroll down the page, we have a little inset map, which you can click into to sort of view and explore more. And then some sort of additional data presentations or breakouts, as we call them, things like our trends over time, some other graphics and visuals. But going back up here to the top, to give you, again, a little more sense of what's going on here. So our indicator for this measure is calculated from record level sort of radon tests from different testing agencies across the state of North Carolina. And we're just looking at the latest 3-year period. And the first measure that you're seeing here is the rate of buildings tested per 10,000 housing units. And so this measure is looking at buildings tested over the latest 3-year period compared to the latest housing unit estimate from 2024. If you scroll down the page a little bit further, we have individual year testing rates. So we could see that, in this report area, looks like maybe our rate has been dropping off over the latest couple of years. It was a little higher earlier. So you can see what those trends look like overall. This is a sort of a 3-year period estimate in the main table here. Again, our report location is benchmarked to our state average. So while our testing rate in Davie is looking a little higher than our state average, our rate in Davidson is a little lower. Davidson is a larger population county, so that's bringing our regional rate down. So let's say if I'm doing work in this sort of 2-county area, I would want to increase my testing rate in Davidson, try to get the word out more there to bring my average up. Yeah, so we've got some charts and visuals to go along with the data in each of these pieces. The individual charts can be downloaded as images for both of these. We're also reporting data on testing rates or results at the different levels. So our high radon levels, our low levels, and sort of that maybe cautionary levels there. Looks like this particular region is showing elevated levels at a higher rate than the state average there. And then scrolling down, we have trend charts for the elevated testing rates as well. At the very bottom of the page here, we have links back out to the North Carolina Radon Program brochures and resources page. So if you pop that open, you can see the full listing of resources for individual counties, for statewide, and for different population sectors like healthcare. And then within the page itself, since I've selected just Davidson and Davie County, we have the quick access to the fact sheets for those individual counties that can pop open as well. So these reports that load for the selected counties here can be downloaded in different formats. The raw data in the tables can be downloaded to Excel. We also have PDF and Word options available for download. So let's say you did want to throw this in a grant application. If you download in Word, you can take out bits of text or specific images. If you just wanted the high resolution images from these graphics, you can download those as SVGs, PNGs, and otherwise. So that the data here is hopefully really A, easy to access, and B, usable for your different applications. Another nice feature is this share button. So if you've created a report for, let's say, your AHEC region or your individual community, clicking the share button here generates a unique URL, a short code that you can copy and share in your social media post, or to link back to in your application. So if you want the web version of the data, that short link will take you directly back to the page that you've loaded. Yeah, so that's how to access the data in the report. In addition to the report tool here, we do have data in the map room as well. So you can access the map room through those through the homepage, through the navigation tabs, or if you've are already in the report here, clicking this View Larger Map button will pre-populate a map with the selected indicators loaded and sort of zoom to your report area. So I'm going to start there, because sometimes it's easier to start with something on your canvas rather than a blank slate. The map room, we could spend quite a long time just training on the map room itself. But just to sort of give you a quick overview of what's going on here, in the Legend tab here, you can toggle on or off the different layers. So from that Radon report page, we're going to load a map with your report location. So our county is selected. And I have two maps that load on default here. One is our elevated radon levels percentage layer, and our other one is this radon testing rate layer. And both of these are loading with data for this 3-year period. The left-hand menu here lets you toggle those layers on or off. And we can also see toggles to change the time period. So we can look at just the rate, the latest single year. We can look at a 5-year average rate, or that 3-year period that we're sort of targeting for our latest needs assessments. In addition to just viewing the map, if you click on an individual county, you can see the pop-up attributes for both both of the layers that are being displayed, as well as some of those minimum, median, mean, maximum test results. And then let's say I wanted to download this data from the map room, because it has some of those extra attributes that we're looking at. There is a Tools tab here, where if I choose this download data option, I can draw a bounding box on my map and then get a selection of counties. I want the whole state. I need to, make sure to cover the whole state with my box there. And then I can sort of see a quick table and export of that data as well. The map room has access, in addition to those layers that preloaded. Let's see if I can turn that off. Back to my tool list. The Add Data tab will let me search for additional data. So let's say I wanted to layer it with something like household income or total housing units. We could search for those terms and get some results. And you can see we have lots of data from those national sources, like the American Communities Survey, from the US Census Bureau. If we wanted to look at the additional radon layers that we have, again, searching a term like radon would allow us to see the different layers we have from our North Carolina source, as well as our national sources. I like, since we are loading in and sort of trying to emphasize data from our North Carolina agencies in this tool, but we do also have those national data. Clicking this group results by topic or by source will let you really quickly see where those data are coming from, if it's a state-specific source or a national source. So we've sort of organized the map room into those two main buckets. And then within that, our data are further categorized. But just to make sure we're just looking at data from North Carolina sources and not from CDC or maybe EPA, if you hit that little group by button, I can make sure we're just looking at the layers of interest. So yeah, we do also have the sort of low radon level testing results and our sort of average or medium testing results, pre-mediated testing results layers available to view in the tool as well. So that's what we have for the map room, and a very quick crash course on how to use some of those features. The map room also allows you to generate a shareable link with the, if you've got it zoomed just where you want it to, with the layers you want loaded. That share button will generate a dynamic link there, and then we can also export the images as PDF and JPEGs. So it was a really quick crash course into the radon layers and reports added to the North Carolina data portal. I do want to mention that we have a support tab on the homepage here where you can get some further information about how to build an assessment and how to load and access data in the map room, because I feel like the map room has a bit of a learning curve along with it if you're not used to using GIS and mapping tools. The assessment tool, hopefully, with just those quick 3 steps is I think more accessible for folks, but just wanted to call out that that's available as well. Yeah, so that is my overview of Radon in the North Carolina data portal.
Thank you so much, Faye. Thank you, Angela. We have time now for any questions for each of our presenters, including myself. So I'll take time. If you would, raise your hand, and we will I'll select people to ask their questions, if you will. I don't see any questions. So if I may, I'll just add one other point, and that is, oh, we do have a question.
Yeah.
Go ahead, please.
Philip, this is
Yes.
Kathy.
Yes.
I just want to say thank you so much. I don't know if everyone on the call knows just how much of an advocate you have been for this work, that were it not for you, none of this would be, present. And due to your persistence over the years, I just thank you so much. You make our products better, and you make North Carolina better because you are making data available. And thank you.
Thank you for that. I did see a question, a hand raised. I think it was Sienna. I'm sorry if I'm not pronouncing your name correctly. Batul?
Oh, I apologize. It must have been a mistake, but thank you so much. I appreciate this presentation, and I love the data portals. I think I'm going to use it. I didn't even know they were out there, so thank you so much. I appreciate this.
Thank you. So my comments that I'll make just as a final statement is that, so what I'm looking for, and I think the same would apply to the other 2 folks, is that there's an opportunity for us to include radon into community health assessments. And the data is now, it's credible data that is being reviewed, particularly by OEE, Occupational and Environmental Epidemiology branch, with these programs with Faye and Colleen and others. So I'm collecting data from these national companies. Together, we are reviewing, cleaning, managing that data to ensure the validity of that data, and then making it available through these 2 venues. I want to also mention, I don't know, Faye, if you want to elaborate on the technical expertise that you all can provide as well. But to mention that the data is available. We do also have fact sheets, brochures, social media imagery to help you with your educational process at a local level. And I do have two individuals from Appalachian State University who are assisting me with creating a toolkit for community health assessments on radon specifically, how to incorporate this and so forth. But Faye, may I ask you to share the technical expertise point?
Yeah, sure. Well, I do also want to point out that my fault, I think I shared a version of the map that didn't have the correct permission enabled, but we do also offer on the tool a data download version that should be the same button that was the download image. It should be on there to also now download the crosstab or like a CSV of the data as well in case you need the raw numbers. Just forgot to point that out. But yeah, as Philip mentioned, we are offering, if you go down on our website, there's a big button that says request assistance. And so, we are here to offer to any help on various data visualizations. If there are, different local jurisdictions and their partners that, either they know exactly what you want in terms of, the kind of data you need, or if you have, here's the issue and I'm trying to see what data is out there, that's definitely something we can help with and help create some of those graphics and tools and whatnot. So definitely feel free to, I think they'll just open like a quick 4-question survey and you can fill that out and we'll get back to you.
Thank you. David Richardson, you have a question.
Hi. First, thanks a lot. This was really interesting and it sort of sparked some thoughts. So I guess I had, in a way, more of a question about if you have guidance in thinking about how to use these resources, this tool, for targeting radon mitigation strategies at the state level, because you pointed to various ways we could think about identifying households at risk. There was an example where there were areas with low testing relative to kind of the prevalence of testing statewide. There were examples of geographic areas where you had high either average or maximal values recorded. And then early on, you had shown examples of where there's radon smoking interactions. And so that you might think of either looking at social determinants of health or zip code level smoking prevalences or something like that. There's lots of different ways where you could think about where the problem of high indoor radon levels is important. But I guess I was wondering if you had thoughts or advice about ways of trying to best identify where intervention should happen.
Thank you for that. And I'm definitely willing and interested in talking to you offline and in great detail about all of that you just brought up. For the basis of today, the intervention that I'm hoping local communities will partner with us on, and that is just to increase the volume or the number of tests that are conducted each year. Quite frankly, even though there is geological features statewide that make it more susceptible for radon to be indoors, we also know that there are buildings that are the source of increased radon indoors. And for that reason, we advocate for everybody to test throughout the state. Choosing Dare County, which is Kill Devils, which is the coastal region of North Carolina, you'll see that the highest rate is 33.7 in that county. So it's my assumption that that is a large building that has been tested, a unit, for example, that's been tested, because we do not, for privacy concerns, we do not collect address data. We collect zip code based data, and that is the way that we collect it. That's the way that, for privacy concerns again. But I think there's other ways or other issues to address over time. And certainly if there is a greater proportion of homes that have higher levels, then certainly that would help guide us as a state agency. But the fact remains is that many of these counties, as I posted for Davidson County or others, we've got counties where 0.1% of the homes have actually been tested in that county over a 15-year period. So we need more data in order to make some decisions. So
Thank you.
yeah, thank you. Seeing that there's not any other questions, I want to just remark also on something that Kathy brought up. I do want to say that I'm very thankful for Kathy Dale. I'm very thankful for University of Missouri, the data portal, Eric Lai, others who have made this possible to include the data in the data portal. And I'm equally as thankful to Colleen and Faye and Sarah Hatcher and others, and all the work that they've done to help make this data set such a credible source of information that can empower people at the local level. With that, I'll just close by saying, unless there's any other questions or remarks from Faye or Angela, any other things you want to bring up? Okay, hearing
No, just
none.
thanks everyone for joining. And yeah, if you have questions as you're using the tool, very happy to, receive feedback on things, and we're here to help you and support you. So thank you.
Thank you.
Yeah, just going to ditto thank you and for your attention and time.
So I'm hopeful that this will spark an interest in the local communities. Please feel free to call me. Feel free to call the other presenters as well, but I'm happy to help guide or assist or empower a local community with making Radon a part of your next community health assessment. I know that they come in cycles, but this is our beginning point. So again, thank you all for attending this. Thank you, Angela. Thank you, Faye, for presentations. And I hope you all have a great day.
Thanks so much. Bye, y'all.
Bye-bye.
Hey, Philip, I don't know
Yes.
if it would be possible for you to put your email into the chat. Would you be willing to do that? I'll just send you out